You are listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician and a certified menopause practitioner that combines the wisdom of natural medicine with modern medicine to help maintain optimal health. She has a special focus in food allergies and bioidentical hormone replacement. Thank you so much for being here. Enjoy the show.
Hi, welcome to my podcast. This is Dr. Marzell, and hope you are having a great day. Today's topic is going to be about use of progesterone versus an IUD for menopausal women. Hopefully you will get great information from this podcast because it's a subject that is very confusing to many women. One of the most difficult areas of providing hormone replacement is balancing two major hormones, estrogen and progesterone. Let's examine what their roles are and the importance of balancing their actions. Menopause means the ovaries are no longer providing estrogen for the body. Estrogen is very important. We know this because receptors for it are all over the body. It protects and helps the function of the brain, arteries, bone, and heart. Some of these organs are just a little bit important for optimal function. Women who are having hot flashes, gaining weight, are fatigued, and starting to have memory problems respond very quickly to adding estrogen to their body. One of the adverse reactions that estrogen can cause is overstimulation to the lining in the uterus. This can cause uterine bleeding. In premenopausal women, the lining typically builds to ovulation, providing a place where a fertilized egg can grow. After the egg is released from the ovary produces a high amount of progesterone. This stimulates the production of passages in the uterine lining, which can carry nutrition to the developing fetus. If the egg is not implanted, progesterone drops after 12 days, and the arteries to the uterine lining spasm and the lining is shed. This is a normal menstrual cycle. And I want to emphasize that the production of progesterone is a total of 12 days. For hormone replacement in a menopausal female, the trick is to provide the good effects of estrogen without thickening the lining, which may lead to bleeding and, if it continues, possibly to cancer. Remember, cancer means something is growing unchecked. So if you have a woman who's on something that causes growth without a balancing hormone that stops that growth, there is problems. Usually the progesterone production is only 12 days of the entire month. The rest of the time, ovaries are not producing it. End of story. It is produced in your adrenals to a certain extent, but not from the ovaries. So when we prescribe progesterone all months to avoid thickened lining, women never get a break from it as they did when they were younger. Let's look at the action of progesterone. This is a hormone that prepares women for pregnancy. It is converted to a sedative, about 85% or so it kind of calms them down. Many women find it helpful to take before bed to help them sleep better. This is true. It can be very helpful for sleep. But this is what it does during a menstrual cycle when it's produced, expecting to set the stage for a pregnancy. It increases the appetite. because you have to provide nutrition for the baby. It stimulates breast tissue and can actually increase breast size. In order to store calories and food for the baby, it slows the gut and increases the absorption of calories from foods. In other words, it can cause weight gain. These effects are reasonable before the preparation of pregnancy. They start with ovulation, last 12 days. These are the symptoms during the PMS aspect of the menstrual cycle. This is when women develop cravings for foods, lack motivation. Whatever women experience in PMS, these are from progesterone. You can imagine taking a hormone like this throughout the entire month when it's usually present for only a third of the month. Some practitioners do not realize progesterone can cause adverse side effects. Particularly worrisome is its stimulating action on the breast tissue. It is actually more mitogenic or able to cause cancer than estrogen is. Some feel it may relieve some of the symptoms of estrogen lack and be safer to use than estrogen. I have seen many patients who have been prescribed large doses of progesterone without estrogen. They are depressed, fatigued, and usually have gained about 30 to 40 pounds by the time I see them and are still having hot flashes. Some women are so sensitive to progesterone that they become depressed, even with the smallest amount. In hormone replacement therapy, progesterone is usually recommended daily. It is swallowed because it is a large molecule. It's not readily absorbed through the skin. Please do not use a topical cream on the skin for progesterone. Number one, it's a large molecule and doesn't get absorbed through the skin. And number two, it's fat soluble. So if you put it in a fatty cream, it doesn't want to leave. It's happy. It's got its fat friends, and it does not get absorbed well. So the exceptions for this, though, if you have a progesterone cream and apply it vaginally, which is a whole different deal. I've seen many women getting this out of the drugstore and smearing it on the insides of their arms, and, it's not the kind of thing you want to use unless you really have to, and you need to be careful about using too much of it. I usually order a yearly pelvic ultrasound for my patients to ensure that the combination of estrogen and progesterone is balanced. Balanced meaning that the uterine lining is not proliferating. The progesterone is an adequate dose to stop the estrogen from thickening that lining. And that the only way to really tell is to do an ultrasound, which is a non-invasive test, and you can measure that lining very easily and see if you're doing a good job or not. It's much better to do this than to wait and say, oh, I hope it's working, and then maybe 2 years later they suddenly are bleeding like crazy and the lining is thick and everything's a mess and they have to go through emergency D&C or something like that. That's not good. 100 milligrams of progesterone has historically been the recommended dose, but oftentimes that is not sufficient, and so that's why a pelvic ultrasound is so important. When you start using 200, and now some people are suggesting 300, this is kind of making women into zombies at that point. Women feel rotten And maybe their uterus is not getting thickened and is healthy and is not going to bleed, but you have a whole organism that needs to work properly and healthily. So this problem with progesterone is why I really like the Mirena IUD. This is a little device that can be inserted directly into the uterus. It has a core on it that produces progesterone directly to the lining of the uterus. It's only a small amount. It doesn't go systemic. In other words, it doesn't turn into a sedative. It doesn't make you a zombie. It doesn't slow your gut and make you crave foods and gain weight. It does not increase or irritate your breasts or put them at an increased risk of cancer. It only bleeps out a small amount of progesterone right where you want it, to that uterine lining. The other deal is that it can be left in there for about 5 years or maybe even more, protecting your uterus so that you can use the estrogen that is so vitally important for the rest of the body without increasing a risk of breast cancer or other problems. This is why I like the Mirena IUD. Thank goodness. And I consider it maybe more of a natural help for women who are trying to get enough estrogen so that they can feel better without putting themselves at risk from a hormone that normally would not be in their system any more than 12 days out of each month from their ovaries. I hope this gives you some information of value, and if so, mention it to your friends as well, because they may be a little confused about everything. Stay tuned for more exciting podcasts, and hope you have a wonderful and healthful day.
Thank you so much for listening. If you learned something, don't forget to share with a friend. You can visit us at www.drmarzell.com. We create content for you. If there's a subject we have not discussed or a topic you want to dive deeper into, let us know how we can empower you. Questions can be submitted on our website under the podcast page. Until next time.